Well, let's move on to more pleasant conversation with our guest, our first guest this morning, making her return to the program, which I feel good about that because, you know, sometimes people come on the program, they're like, well, that wasn't very much fun. But Dr. Filza Naveed from MD Connected has come back. Dr. Filza, thank you very much. As one physician to another, we appreciate it. You didn't know I was a doctor? A lot of people don't know that, but I consider myself.
I learned a lot about you last time, Howard, and I told you I had a fun time last time, so I'm surprised you're surprised.
Well, you never know with us. We can. Here's the thing, Filza, we can sour a room. It's been done. At least I can. Freddie's an angel. Dr. Filza from MD Connected, you know, I don't have any notes in front of me in terms of what you want to talk about, but I've got a couple things I'd like to talk about, which is the idea that, well, first of all, let's introduce everyone. MD Connected, of course, an opportunity to speak to physicians, to get consultations, to get some great recommendations. You know, everyone's got a friend that goes, you know what I use for sleep? I use a little bit of Bubba Kush, and then I take some edibles. But you know, to talk to a real doctor like yourself or somebody else at MD Connected is really a great idea because a doctor will tell you the dosage for whatever malady you're looking to work with. Is this the point?
Yeah, I mean, you know, really when you talk about what you're using it for, if you are trying to treat, you know, a condition, it's kind of like how you would want any of your medical conditions for the most part treated. You go to a doctor, you know, you have someone to sort of help manage your care because, you know, sure, you can trial and error things. You can go to rec shops and you can pick up something and you can give it a try and see if you're successful with it. And you may not be. But by, you know, seeing a doctor about this, you can figure out what, you know, products might be more appropriate, the dosing that might be appropriate. And then you have that option of following up anytime, right? Something's not working. You don't have to like rack your brain about it. You can just come back and we'll talk about it, you know? So yeah, it's definitely worth seeing a doctor about it, I would say.
And, you know, so often people are on medications and they wonder if it's the right medication, is the right dosage for them. They go to a doctor's office and he just says, oh, here's what you need. And he writes you the thing and hands it to you. Well, there's so many people out there, and I've experienced that. Is this probably the best thing for me? And I would like somebody to just concentrate a little bit more on what my situation is and what I might need. So, you know, it's a great idea.
You know, Fred, you brought up such a good point because, I mean, we've all been patients. Like, I've gone and seen doctors for different things as well. And it's amazing how many times that's happened to me, too, where I just get kind of like thrown a prescription. Did I really get hurt? I don't know. And, you know, you don't really necessarily leave feeling like you were entirely well cared for or, you know, had the whole situation looked at. So that's why, you know, our approach is so unique. Like, we go through, you know, it doesn't have to be like a lengthy process or visit, but it is detailed. You know, we go into why you're looking to have cannabis prescribed to you. What are your other medical conditions? What are your current medications? You know, where do you rank on anxiety and depression scales? Like, what do you do for a living? Who do you live with at home? Like, we really look at the person as a whole to figure out, you know, exactly that. First, is it right for you? If it may be right for you, let's figure out a good plan for you, you know, to kind of maybe start low with it and go slow and until we kind of hit that spot, you know, where it's really working well.
You know, one of the things about MD Connected is someone listening might go, well, I could just go to my regular doctor. And nothing wrong, taking nothing away from, you know, your average GP. But they're not really as educated as you'd think they'd be in terms of cannabinoid, you know, dosing. And that's what's great about MD Connected, right, Dr. Naveed? Because you guys are cannabis specialists.
Well, we make sure that any of our doctors who decide that they are interested in prescribing, they go through proper training for this. We give them a lot of information to sort of review, a lot of cases and example cases so that they're able to sort of envision different scenarios and see how they go about it, right? It's not just like, okay, you want to prescribe, go ahead. Like, we want to make sure people know what they're doing. And honestly, like, it's quite unfortunate, but the medical school and the residency programs, like, they don't teach a lot really at all when it comes to medical cannabis. We just know, in the past, recreational drugs, okay, cannabis, medical, conditions that cannabis can be treated for and when it's not considered recreational, here's a list. And affecting the endocannabinoid receptors. Sure. That's about it. Nothing about dosing, nothing about the different types that are out there. So a lot of doctors do come out of it really just not knowing enough, when it comes to it. So it's important that they get trained and they get that education.
I think, I'm not sure if I brought this up or Fred brought it up the last time we talked, but we've had this conversation about a lot of people in their 50s into their 60s who may have used cannabis as kids, but now they're a little afraid of it. They're like, and I run into that, even in my circle of, people go, it makes me paranoid or whatever. But I think talking to somebody from MD Connected might certainly educate a new user and also maybe assuage or whatever, settle down somebody's concerns about the anxiety of taking weed. But I mean, people take, crap from their doctors all the time. But here's something that might help you that's organic, that's not oxytocin or something. Can you talk a little bit about that?
Yeah. And I think the other thing, too, when you mention, people in their 50s, 60s maybe coming in for this, some of them may actually be on other medications, too. So another push would be potentially, you can't say always, it depends on the medical condition, but if you're getting where you're treated with other oral medications potentially for this, maybe we can start lowering the doses of those or get you off of those, right? So it's definitely a conversation that's worth having. And definitely, the one thing we want to keep away, like, there's no stigma attached to it when you connect with us, right? These are all real problems. We're trying to create real solutions that are safe and they're individualized, right, for each person.
All right.
Well, I know the conversation I would have with my doctor if medical marijuana came up, it would be, well, try and see how it works. That would be the extent of it. No, that I think at this, a few years ago, he would have said, no, that's quack. That's quackery. Yeah. But now he would say, just try it and see what it does for you. And that's what's good about MD Connected because, a lot of people, the leap from recreational to medical is hard for them to get their head around. And you need time to have that explained to you.
Yeah, absolutely. I mean, when I came out of it, I didn't know a lot about it. I hesitated a bit. I think it was just not knowing. It was more that fear of the unknown. Like, I haven't done this before. I haven't had formal training on it. Like, am I, and then I did get some training on it and I studied it further and I realized like the utility of it. And, I mean, it's been great. It's been great to help people in this way.
I can tell you, Dr. Naveed, in my practice, where I've been treating this one patient of mine, me, for many years, trying to work with different dosage, and I think I've come up with some great trials, and I might share them with you. MD Connected. Of course, their partner, Medical Cannabis by Shoppers, providing patients with access to a growing list of licensed producers from all over Canada and ensures all prescribed cannabis products adhere to the highest quality and safety standards. Dr. Filza, thank you very much. We appreciate it. You're always welcome here.
Thank you so much. I appreciate you having me back, and I'd love to come back again.
Please, anytime. Actually, at one point, I would like to have a real conversation about the best dosing, because one of the things people love about medical marijuana and marijuana in general is its sleep qualities. But I haven't found, because sometimes people say that it makes them not sleep, and I think I haven't found the right dosing. And believe me, I've done some trials. So maybe next time we can talk.
Yeah, we should sit down and kind of talk about what you've done, the different dosing strategies, the different products maybe you've tried, and see if we can figure it out.
I would love to.
Yeah.
All right. We would talk doctor to doctor. It's the high level stuff.
Of course.
All right, Doctor Naveed, thank you very much.
Thank you. Bye.
Thank
That's
you.
Filza Naveed. There you go. She's gone now.